Okay, here we go.
Hi, Miss Jones. How you doing? I'm gonna do your abdominal exam.
Okay.
All right. So, when you do the abdominal, would you mind laying down? I'm gonna put this feet thing up so you're not, your leg, oops, hold on. Okay, there you go. All right. When you're doing the abdominal exam, you're doing the techniques a little bit out of order. You're gonna inspect first, you're going to auscultate, you're going to percuss, and then you're going to palpate. If you don't do that correctly, your sounds are going to be out of whack. So what I'm going to do first is I'm going to observe the general appearance of her stomach, and what I'm looking for is the contour, movements of the abdomen. So I'm looking at the surface to note the color, to note if there's any scars or striae, any dilated veins, or any rashes. So striae are stretch marks. I'm going to notice if it's rounded or protuberant or if it's scaphoid. Sometimes you'll see a protuberant abdomen in patients that have liver failure. I'm also going to note symmetry. So again, I'm going to go back to the liver example. If patients have liver failure, their liver is going to be enlarged and you're going to be able to see that. Or if they have a mass, if they have an abdominal aneurysm, they're going to have a large mass here, a pulsatile mass. Also, you're going to note if you can see any of the organs, and you're also going to document if you see pulsations. So the next thing I'm going to do is I'm going to auscultate. And so before I palpate and percuss, so I'm going to use the diaphragm of my stethoscope and I'm going to listen for 5 minutes in each quad. So I'm going to divide the abdomen into the 4 quads, and you're a nurse so you understand how to do this, okay? And then I'm going to listen and I'm going to document what I hear, okay? So I'm listening. And I'm really not going to listen to her for 5 minutes, but you're listening for bowel sounds, which are gurgles or clicks. And then you're going to document those. And then you're going to listen with the bell of your stethoscope over the abdomen, gently and lightly. And if you're hearing pulsation, if you're hearing a bruit, which is usually sounds like a whoosh, 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 then you're going to send the patient for further testing, and usually we do an ultrasound. There may also be friction rubs that you can hear over the spleen or the liver or some abdominal masses. And then next we're going to move on to palpation. So palpation, you're going to do light palpation, and then next you'll do deep palpation. And so what palpation does is it aids us in the detection of tenderness, muscular resistance, and some superficial organs and masses. So what you do first with light palpation is you position your hands in a horizontal plane with your fingers together, and you do it flat on the abdominal wall, and then you're going to palpate it with lightly dipping your hands. And I also move in a circular motion, okay? And I look at the patient and I watch for grimacing, changes in their facial expression to see if they're noticing, if I notice any changes, because that can be guarding, tenderness, and so I do that. And then you do deeper palpation, and deeper palpation, you're going to use both hands. And so with deeper palpation, you use this not only to find out about more guarding, but you're going to use it to identify the liver edge, you're going to use it to define deeper masses, you're going to use it to define the kidneys. And if you do find a mass in someone's abdomen, you're going to document the size, the shape, the consistency of a mass. You're also going to talk about tenderness, where it's at. So one thing patients may come in with is peritonitis, and there's special tests you can do if you have a patient that has peritonitis. There's a cough test. So would you cough for me? Does that hurt anywhere? Okay. There's also an involuntary guarding test. So again, you're doing deep palpation and you're watching them to see if their muscles in their abdomen tense up, because that would be a sign of guarding. You're also going to check for rebound. So I'm going to ask the patient, when I push down and then I let go, which one hurts the most? Do they hurt whenever I push down or when I let go? And then they're going to tell you, okay? And then I'm going to percuss the abdomen, and I'm going to ask them to tell me if it hurts when I percuss, okay? And then you would document if they have percussion tenderness over that area. So now I'm going to assess the liver, and you assess the liver by palpation and percussion, okay? So I'm going to do the liver size first. And so I'm going to assess the liver. I'm going to start at the level of the umbilicus, and I'm going to move upward with percussion. And I'm going to try to hear the difference when it gets dull. So that was about right there, okay? And then I'm going to start at the nipple line, and I'm going to percuss down. So right there. So I'd say that's probably 6 to 7 centimeters, and that's pretty normal for a liver, okay? And then I'm going to palpate the liver. So I'm palpating the liver. I'm going to place my right hand on the patient's abdomen, lateral to the rectus muscle, and remember the rectus muscle is in the center. And I'm going to ask the patient to take a deep breath, and I'm feeling for the liver, and it's right there, okay? And then there's also another technique, but I'm not going to do it on her because it really hurts. You're going to stand to the side of the patient, and you're going to use both hands, and you're going to be in a hooking motion. So you're going to kind of like put your hands like in a hooking position, and you're going to ask them to take a deep breath. Okay? Now I'm going to palpate the spleen, and I'm going to percuss the spleen. So I'm going to percuss the lower anterior chest wall from the border of the cardiac dullnus, which is usually a 6th rib, and I'm going to go down to the costal margin. So your xiphoid process is right here, and so your 6th rib is, let's see, that's about 10, 11, 12, or 10, 9, 8, 7, 6. 6 is about right here. It changed sounds right about there. So that's probably where it is. So I'm going to have, the next thing I'm going to palpate. So I'm going to have the patient keep their arms at their side, flex their hips. Would you mind raising your legs up? Okay. And then I'm going to reach around to the patient to the left side. And I'm going to push up. Sorry, did that hurt?
No.
And I'm going to push there, and I feel her spleen. Take a deep breath. Okay. And it's under the costal margin, which is where you want it to be. Okay, next, if I suspected she had a kidney stone, would you mind sitting up and turning to me? And I'm going to check for CVA tenderness. And actually, this is a kidney punch. So I'm going to put my hands here on the patient over their kidney. And then I'm actually going to hit my hand. Did that hurt? That did not hurt. So you can go back to where you were. She does not have CVA tenderness. You can lay back down. Okay. And then I'm going to check for the urinary bladder. So I'm going to percuss again. And I'm going to check for dullness so her bladder is not distended, because sometimes I've had bladders clear up to here. And then I'm going to assess for roundness and fullness, and her bladder is not full. All right. Then I'm going to palpate the aorta. to see if I can feel any pulsations, and I don't. All right. The next thing I'm going to talk about is special techniques that if you suspect that the patient has appendicitis, you will have the patient, you'll be palpating here around their appendix area, and you're going to do a Murphy's sign, a McBurney sign, I'm sorry. You're going to palpate here, and then you're going to see if there's any tenderness. And then if you think the patient has cholecystitis, you're going to do a Murphy sign. So then I'm not going to do this either because this kind of hurts the patient. But you're going to push on their gallbladder area, which this is their epigastrum, and it's a little bit further to the right. You're going to push and have them take a deep breath. And if they have a positive Murphy sign, then they're going to hurt with that. And then if you have patients that have hernias, you're going to have them raise both legs and do a Valsalva maneuver like they're going to have a bowel movement, and you can sometimes see the hernias pop out. So that's all I have for today. Thank you for watching. Thank you for participating. I'll see you next with the next assignment.